So, what does a black doctor have to wear these days to be considered to be a doctor and not be mistaken for the help? A lab coat's not enough, a stethoscope, a tag that clearly says doctor. Take a look.
Today I got mistaken for patient transport again by the nurse when I walked into the patient's room when my badge clearly says doctor. This isn't the first time it's happened, and at this point it's kind of funny. I did not think that I would get used to these microaggressions so early on in residency. For those of you that don't know what a microaggression is, it's essentially whenever someone makes an assumption about you based on your race, your age, or your appearance. Even if it's unintentional, it undermines your role and your identity. In medicine especially, I think these moments matter because they can chip away at your confidence, reinforce different stereotypes, and can even affect how your patients and their families view you as a professional. For me, honestly, I kind of just laugh at them, but they're still there, right? A simple fix for this is to not assume. Like, I never assume someone's role when I enter new spaces. Never assume, just ask. Respect in healthcare starts with recognition, and we all need to do a better job at respecting each other, right? We need to do better at, not having to deal with a lot of these microaggressions.
The reason why nobody noticed the fact that he was wearing a tag that says doctor in bold letters is because all they're seeing is a black person. And he's a young looking black man, but there are a lot of young looking doctors that are of the folks as well. They're not mistaken for the help. They're not mistaken for a patient transfer or a cleaner of the hospital. And this isn't the first time that this particular doctor was mistaken or not believed to be a doctor. He was on a flight and there was a medical emergency with one of the passengers on the flight. And they called for a doctor. And when he came, they didn't believe him to the point where they actually even refused to let him help, which is just insane that they found it so hard to believe that he's a doctor. It didn't matter that he had his credentials. Because I guess if you're black and you say you're a doctor, it's not believable. Even if you have credentials, then maybe those credentials are also fake news, right? Insane. And like this doctor said, the microaggressions that come with it and that people should just be respectful. Well, unfortunately, when it comes to the medical field and black people, respect goes out the window, okay? And we know about all of the reports of the anti-black racism that nurses, doctors, orderlies, anybody in the medical profession goes through, okay? So it's not something that we can expect oftentimes. And that is why I always say over and over and over again that we need our own institution. We need our own, that we can, have our own doctors and our own medical staff and, our own patients, like from our community, And I hope that one day we get there so that we're in a position where people in healthcare who are there to save our lives doesn't have to go through this. That's the last kind of stress that a doctor or nurse or anybody in the medical profession needs. It's already stressful enough in that position, leave alone having to deal with anti-black racism and discrimination and, disrespect of being, assumed to be, lower end position than what they went to school for like 7 years to be, right? So, I mean, what are you going to do? I firmly believe the only solution is for us to separate and have our own. Let me know what you all think about this. Don't forget to like, subscribe, share this content. Also, don't forget to download the African Diaspora News app from your Google or Apple store. You will not be disappointed. And subscribe to my YouTube channel, Ansah Unfiltered. Until next time, please be safe.